make sure you're staying on top of the assignments that we're doing. And like I said, when we're getting into those extremity and those motion assignments, you're just trying to obviously match the muscles that are being used during each of the phases. So think about, is the action a concentric shortening, isometric holding the same position, eccentric lengthening, and so on and so forth. So since I don't see any questions, let's go ahead and start talking about the upper extremity, which involves a whole lot of not just different muscles, but obviously different movements. So the first joint we have is our sternoclavicular joint. So effectively, our clavicle is coming in to our manubrium. That's where it's going to go and interface. It's kind of a modified ball and socket. So if you roll your shoulder, you can feel how it's going to articulate inside on both sides of the body, as we're going to be able to put ourselves into a variety of different scapular positions, which then is going to allow for a variety of different shoulder positions when we happen to be trying to obviously lift some weights or ourselves or anything else. Now, from there, we then have the scapulas. So the scapulas on the back side, we're talking about where it's essentially the bones that are going to be able to float around and move thanks to the musculature that they happen to be anchored to. Now, the clavicle and the scapula is coming together at that AC joint. And I'm sure some of you guys that have played sports like football where you're tackling otherwise, you maybe have either had a friend or yourself separate an AC joint once in your life. Definitely not something you want to go ahead and look into. Now, we're going to find muscles, obviously, that are attaching to pretty much all these different locations on the scapula. Now, on the anterior and the posterior is what we're seeing. Anterior is the side that is literally up against your rib cage on the inside. And this is what's known as an irregular joint, okay, between the AC joint and the clavicle. And then notice after that, it's not a joint, it's just muscle floating in space. Now, what's interesting when we're looking at our scapula compared to looking at our hip, we've got these two big pieces of bone that either coming together with the pubic symphysis and the SI joints. There's a little bit of motion there, but not much. Whereas thanks to our scapula not being anchored to anything other than our clavicle, it effectively floats around. So the way that we stabilize our shoulders is literally through the musculature of our upper back. So the coracoclavicular joint, that is going to be where we're going to have a binding through ligaments of the clavicle to the scapula itself. Now, next joint we go on down is going to be the glenohumeral joint. So that's the glenoid fossa of the scapula, and then the humerus itself, where it's going to be able to move in a wide variety of positions. It's a very, very shallow socket, and that allows for major mobility as we're going through the shoulder joint, especially when you think about the hip, okay, which is much deeper, much stronger. So it's obviously much harder to do things like dislocate your hip. Now, we've got a variety of ligaments that are going to be holding that into position. We have a number of muscles that are obviously crossing the junction as well. And notice the cricoid process and the acromion process, which those outriggers of bone effectively, when we're in different positions, we can kind of have some rubbing and friction, and that's where we can get into some bicep tendonitis and some other potential issues when we're going overhead. So the nice thing is thanks to the size of the head of the humerus and the very shallow glenoid fossa, this gives us massive ranges of motion, internal external rotation, horizontal, ABA deduction, and then flexion extension. Whereas in the hip, we can do all those positions, just typically nowhere near the same amount of range of motion. And the major disadvantages here is it's easy to dislocate a shoulder relative, once again, to a hip. Now, we then have what we refer to as the scapulothoracic joint. And this is going to be the articulation between the scapula itself and the thoracic wall. So notice they slide on one another, okay? This is going to be thanks to a wide variety of muscles that are going to allow this to occur. So what we have on the back side of the body, okay, is the upper back, which allows us to shrug upwards. That is going to be our trap underneath. We're going to see a little bit of the levator scapulae, and then our rhomboid, which is underneath our mid-trap, all of which are going to contribute to elevating the scapula. We then have depression of the scapula, which is pushing our shoulders down. This is by the lower trap fibers, and then our serratus anterior. It's that fan-like muscle that you can feel on the front side of your shoulder a little bit. Then we have got upward rotation. So as I'm lifting my shoulder up, you can see how that scapula is going to upward rotate. And then we can get the same type of downward rotation as we're coming down, especially if we're against load. Now, the upward rotation is being done thanks to, remember, force coupling, guys, the upper trap pulling on it, the lower trap pulling on it, the serratus anterior, all of which can give us that rotation. Whereas with depression, it's going to come mostly from the rhomboids, and then we can even have a little bit of effect through our pec minor, a little bit through the serratus anterior. Now, that doesn't even begin going into retraction, pulling the shoulder blades back, which can be done by our mid-trap and our rhomboids, and then protraction, which is going to be being done by our pec major minor, and also a little bit of that serratus anterior, allowing us to move our shoulder blades forward. We're also going to have tilting anterior and posterior. That's another side out that we're not going to really focus on too much here. Now, why we care about all this is because it's very, very important when we are trying to get our arms to move. We naturally want to have the scapula go with it. So when I'm pulling an object into me, I should be retracting my scapula. When I'm pushing something away, I should be protracting my scapula. There's a couple changes you're going to see with that when we're talking about things like lifting really heavy bench presses where you want to be pinned down into place, but that's a different story. That's more of an extenuating circumstance. Then we're going to have other positions, like whenever we're going overhead, we want to also have that upward rotation of the scapula when we happen to be pressing weights over our head. So we're going to have a lot of dynamic movement with our scapula as we're using our arm. And when we don't have this, that's when our body is going to have to compensate. And by compensating, because we're now having to do a greater range of motion with the shoulder because the scapula is not functioning like it should, and now that that shoulder has to move through a bigger range than it's meant to, and meant to do safely, we can obviously have major risks of injury. So we've talked through our different motions: elevation, depression, protraction, aka bro at the rec center 1, retraction, pulling our shoulders back, then that wonderful upward rotation and downward rotation along with tilt. So you can kind of tilt yourself forward. Now, the scapulothoracic joint is really just stabilized through muscles, okay? This is incredibly important. And especially for you guys that have got the shoulder joint, the scapulothoracic joint is arguably part of that shoulder joint. So you have to think about how that's going to be articulating and moving as you're going through your movement pattern, given the exercise that you have chosen for this class. So again, when we're going up, elevation, now we're talking about the upper traps. Now we're talking about the levator scapulae. When rhomboids have a mild effect here, but nowhere near as much. We're talking about pushing it down, depression. You can see those lower fibers of the trap along with our pec minor on the front side is going to push us down. So if you're doing barbell dips or bar dips, you're going to feel yourself push yourself down at the top, and that's going to be partially being performed by that pec minor. We've got those protractors. So once again, pec minor, and then our serratus anterior. And that's what I mean when I say fan-like muscle, when we're looking at how that serratus actually looks. We then have our rhomboids, and then this is going to be our mid-trap fibers that are going to be pulling our shoulder blades back together when we happen to retract our shoulder blades. We then are going to have that upward rotation being done mostly by the upper fibers of the trap. However, remember, it's being contributed by the serratus anterior as well, and a little bit also from the lower trap fibers. Now, when we talk about downward rotation, we're going to have the rhomboids on the back and the pec minor on the front rotating, so we're going to naturally get that rotation of the scapula into the downward position. So Any questions through the basic muscles that are allowing our scapula to move, how they're going to articulate, so on and so forth? In theory, you guys have gone through all of these muscles before in your anatomy and physiology course. So focus on the muscle actions, origin, insertion. I'm never going to ask you guys about the innervation. All right. So let's talk about flexors of the glenohumeral joint. So flexion of the shoulder is going to be raising the arm straight up. Okay. Your anterior delt is going to be doing a portion of it. The clavicular portion of our pectoralis major, along with our coracobrachialis and the short head of the bicep brachii, are all going to be helping ourselves lift our arm straight up in front of our body. The major movers here are going to be that anterior delt, which this picture is actually poorly drawn. That's why I have the other one appended. So you can see the fibers on the more anterior side. The medial fiber is going to be more in abduction of the shoulder. And then you can see the fibers of the clavicular pec. Now, extensors is bring our arm down. Okay, this is going to be done mostly by our latissimus dorsi. Teres major is going to assist, as will the sternal fibers of the pectoralis major, and then a little bit of assistance of the long head of the triceps. So you can tell we've got those fibers on the backside of the body with that lat. It's really going to be able to grab and pull something through. The teres major is going to be an assistance to this. And you're going to see a contribution of the pec fibers, specifically more so when we're further away than when we happen to be closer. Because if you can imagine, as these muscles are being stretched, as we're getting into extended positions, in turn, we're going to require greater forces from them. And then when we get into the shortened position, you can see how the pec fibers now here aren't actually able to help me pull my arm backwards anymore. They're not in a mechanically leveraged position. If anything, they're going to pull my arm forward. So we have to keep in mind, yes, they're contributors, but not the major movers. So just to give you an idea of the sheer size of your lats. Now, muscular thickness, like the thickest muscle in the human body for a healthy individual, should be your glutes. Now, the longest muscle, however, in your body, as far as space, should actually probably be your lats, your latissimus dorsi. And so if you look at how wide those fibers are, going from effectively the top of your hip to your thoracic spine, all of that is going to be contributing to pulling that arm through. Now, the long head of the triceps, as you guys can see, is actually going to be connecting into our scapula. So aside from helping us extend our elbow, which we're going to learn in a bit, it's also going to be pulling our arm down and through. So our major abductors of the shoulder, so going straight out to the side, is going to be our middle fibers of our deltoid, so the medial delt, and then the supraspinatus, which is one of the four muscles of our rotator cuff. The supraspinatus, what it's really doing in those positions, you can see that as middle fibers, anterior on the front side, posterior on the back side. What you're going to find is it really is just beginning to get our arm to move correctly. And then everything after that is going to be our middle delt, okay? The other three muscles of the rotator cuff, because we have four of them, all of them are very important in making sure the humerus stays inside of the socket and articulating correctly. So now when it comes to bring our arm down adduction, now it's the lats again, the sternal pec, the teres major, and then the short head of the biceps and long head of the triceps are all going to give a bit of a contribution to those movements. So if we can imagine those muscles being lengthened when we come out to the side, you can easily understand how you're going to be able to pull that in. Now, the four muscles we're going to have of the rotator cuff are going to be our supraspinatus, our teres minor, our infraspinatus, and then our subscapularis. Okay, infraspinatus is going to be I'm not that small, so it's gonna be right back in there. Subscapularis is gonna be literally inside of the anterior portion of your scapula. So when we're trying to go medial rotation, so internal rotation of the shoulder, that's subscapularis, our teres major, along with our pec, our delt, and our lat, and even the short head of the biceps are all going to contribute to internal rotation. Now, external rotation is going to be that infraspinatus on the backside and that teres minor along with a little bit of assistance of the posterior delt. So we just think about sizes of muscles and everything else. We've got a lot more ability to internally rotate with force than we have the ability to externally rotate with force. So it's an easy thing to effectively become unbalanced with if we're not careful with our training. And the key is, okay, if we're going to go and we're going to throw a baseball, okay, we're using all of those muscles to contract to get our arm up to speed. Now, in turn, after they've done their concentric action, we now have to slow that arm down with that infraspinatus and teres minor and even the posterior delt, which is going to go through an eccentric contraction. So we need to have strengths on both sides of the body. We cannot be strong on only one. And also remember, guys, bones are slaves to muscles. Wherever all of your strength and tightness is, that's the way that your bones are going to be being pulled. And that's why you see the bro at the rec that's trying to walk around like he's big, because all of these muscles can start to get tight and the muscles on the backside of the body are lengthened. And all that really shows is poor overall development and a very much so increased risk of injury. So if we're going to now try to image those internal rotators, now you can see that subscapularis, so it's set on the anterior side, so it's looking through the rib cage, along with that teres minor. We can see how that attachment on the posterior and inferior components of the scapula, and we can see how it's then more attached into the effectual anterior of the humerus. So as we externally rotate that arm, we're going to wrap that muscle further and put a little bit of a stretch on it, along with the assistance we're going to get. And then once again, our lateral external rotation, you can see that infraspinatus, where it's going to be going as it pulls, it's naturally going to go and externally rotate that shoulder, along with that teres minor, and you can see how, in fact, minor it is. And then remember, you're still getting some contribution from the posterior delt. So, horizontal abduction of the humerus, okay? So now we're talking about bringing ourselves back when we're up horizontal, so we're going straight across the body. So we're going away and then adduction, okay? Now, what we're going to see is, notice it's going to be that posterior, in a little bit of the middle delt, infraspinatus, and the teres minor. Now, we might get a little bit from the teres major and the lat, but that's more if we're going from a high, or if we're going from a lower angle than a high angle. And like anything else, if we're trying to have muscular balance in our development, we need to make sure we're putting this into our training in general. So we're looking at from the backside of the body, so it's going to be more of the posterior fibers of the delt, not so much the middle fibers, the infraspinatus and the teres minor. Now, horizontal adduction, that's going to be basically your pec majors. That's really what's doing it. Anterior delt crackobrachialis can help a little bit, and same thing with the short head of the bicep brachii. When we're thinking about these muscle actions, think about which is the major powerhouse that's going to allow us to do this, and which are going to be more of the smaller assistance type muscles. So if you look at literally the size and the attachments of your pec, you can obviously see how you've got this massive muscle belly that can pull you across. And then you got this nice, cute little anterior delt and this crackobrachialis, neither of which are going to be able to contribute anywhere near as much to those movements as you're going to go ahead and be able to see with that pec major. Now, obviously, thanks to effectively the massive amount of mobility we have in the shoulder, we also are going to really increase our risk of injuring the shoulder. So we're talking about dislocations, we're talking about injuring our rotator cuff, we're talking about just general rotational injuries, and then some type of subscapular neuropathy or otherwise where we might not have functioning like we should. So specifically when you're talking about impingement, okay, in the shoulder, this is typically from doing a lot of overhead movements where we can start to have that rubbing thanks to, we talked about at the very beginning today of the wonders of the bony situations you do have on your shoulder. So you're effectively going to have those tendons rubbing a little bit every single time we go overhead. And if the tendons aren't able to tolerate effectively that over a long enough period of time, it's going to obviously present as pain. So now notice, guys, for the upper extremity, literally the first 40 slides are simply covering the shoulder and the scapula. We're only going to spend 20 on the elbow and the wrist and hand. So you can guess where there's going to be a lot more information you need to focus on and make sure you guys understand. So I guess since we don't have any questions, let's keep powering on through. So we then have the elbow, and that's going to be the humerus ulnar joint. So remember, it's the ulna that actually where we're going to have the actual joint occur at. Okay, this is a hinge. That's hopefully all it does is act as a hinge. So this is going to have flexion and extension. Flexion is bringing it towards us. The major mover there is going to be the biceps brachii. We're also getting the brachialis, which is underneath, and the brachioradialis, which is right above and a little bit to the side. Okay. All three of those are going to function with trying to lift our palm up or lift our hand up. It doesn't necessarily be palm up. Palm up is going to naturally, if you guys can look at your arm and then turn your wrist up, you're going to see your bicep shorten because actually the bicep helps with what's known as supination of the wrist. So from there, if you're trying to arguably train your biceps brachii more, then indeed you actually want to have your palm facing up. Now, if you're trying to train your brachialis and your brachioradialis, that's when you want to be in a neutral kind of a hammer grip or be in an overhand type curl position in order to train that brachioradialis. So another way to see the brachialis, it's underneath the bicep. So if you make it get swoller, then your biceps look bigger because it naturally makes your biceps sit up higher. Yay. Now, when it comes to our ability to straighten our arm, it's going to be done typically by the triceps brachii with a slight assistance from the anconeus. Now, the anconeus is a very, very small muscle here that's helping effectively with trying to effectively lock the elbow and keep ourselves in the correct position. That long head is going to be obviously connecting into the triceps tendon, but it's going to be back in the shoulder. The lateral head is going deep into the humerus, and the medial head is going more to the side. Yeah, okay. Going back on in. So all of those obviously are contributing to straightening your arm. Now, here's the thing. If we're in an overhead position, that's where we're going to effectively be getting the greatest stretch on the long head. Whereas if we're in a standing straight position, we're going to be getting arguably a little bit more of effect on the medial head and or lateral head of the triceps, thanks to the mechanical positioning. So in reality, if you're going to try to, do bodybuilding to build muscle mass, or effectively you're trying to do some type of correctives where you're just developing certain muscles over others, it is important to understand these biomechanics and specifically these muscle actions and these attachments, because the only thing a muscle can do is shorten. So that literally means pulling the bone, the effectively whatever it's anchored to, closer together. So if you then think about what exercises are going to naturally cause certain muscles to have to function in a way that you're more interested in, well, that by the nature of the beast is in turn going, to get you to use the muscles effectively along the lines of what you're obviously hoping to accomplish. So we then have the humeral radial joint and our radius. So think rad, thumbs up, ulna, pinky. It actually floats above. So it will rotate a little bit, but it's not really getting or doing much real force transmittal from what's going on directly in the elbow compared to what's going on with the ulna. But obviously it's still supporting with the ridge as far as it doesn't have muscles that are going and pulling on the bone itself. It's just kind of along for the ride. So the radial ulnar joints is going to be where these two are going to go ahead and naturally cross over. So with my palms up, my ulna's on one side, my radius on the ulna, or my radius on the other. As I pull my hand over, I'm now twisting the one over the other. And that in turn actually causes those bones to literally be twisted on one another. Now, pronation is going to be turning your wrist, effectively your palm, away from your elbow joint, okay? Supination is going to be lifting our palm up, okay? So the muscles are literally named after the action. So we've got our pronator quadratus, which is pretty close to our wrist, and then our pronator teres, which is actually going to be crossing over that elbow joint, which could be a potential cause of some, shall we say, a little bit of elbow pain or otherwise if we happen to be doing a lot of work that is requiring a lot of pronation and or supination. Now, we do have the supinator muscle, which is going to turn that palm up, but remember, again, the biceps itself is going to be helping with it. So when we get to the wrist here, this is going to be the radiocarpal joints, and these are what's known as condyloid articulations between the radius and our 3 carpal bones. And in turn, we're going to then have what's known as the retinacula at the wrist, and this is the fibrous band of fascia that is literally going to give you the protective pathway that we have all of our tendons go through. You don't really have, aside from right here, any muscles in your hand. Okay, it's all tendons that are running to the muscles in your forearm. So literally, if you go and you just push down aggressively on your palm, you can actually, if you just think, let your hand relax and then push here, your hand will naturally close because you're actually pulling on those tendons. Now, it's also where the nerves pass through and the blood vessels to your hand. So I'm sure you guys have heard of people having carpal tunnel before. So we can obviously have some issues. Now, when we're going and we're thinking about flexing our wrist, so flexing our wrist, bringing it down, okay? That's gonna be done by our carpi radialis, ulnaris, palmaris longus, and then our flexor digitorum, superficialis and profundus. So superficialis meaning more superficial of the two, profundus meaning a bit deeper. So literally all of those 5 muscles effectively are going to allow you to flex your wrist. Now extend your wrist. Now we've got our carpi radialis longus, brevis underneath, ulnaris, and a couple other wrist extensors that are going to allow us to lift our wrist up. We've got a large number of muscles that are obviously running through our wrist into our hand. That's going to allow us to move our hand and our fingers. Now, we then have what's known as the carpometacarpal joints, and these are going to be effectively where our carpals and our fingers are going to be meeting up, more the sliding joint of the saddle joint down on the thumb, and then the gliding joints just off the metacarpals. So we're getting to the phalanges next. Then the inner metacarpal joints, okay? These are going to be relatively irregular joints that are going to move between the 2 of them, but we're not going to necessarily see a whole lot of flexibility. And then we get to the metacarpal phalangeal. So now we're getting into your phalanges, aka your fingers, okay? And this is where we're going to effectively have the knuckles of our hand, okay? Now we say condyloid joints, okay? That means we're going to have one side that's rounded, the other side that's going to be open. So you can see how the finger is a little more rounded, the carpal is going to be a bit more rounded. The phalanges is where we're going to be a little concave, and they're just going to go ahead and roll along. And then our inner phalangeal joints are going to effectively be a bunch of basic hinge joints. Now we do have the ability to essentially have lateral and medial deviation, along with, we have flexion extension, and then we have circumduction. You say, woo, who cares? Because you guys are probably tired of listening to me. So what all can we do in those joints? Well, turns out we can get that, once again, we can go into flexion, extension, abduction, adduction, and circumduction. And muscles that are responsible, well, there's going to be 9 extrinsic muscles, okay, that are going to both be effectively at different points farther from and right around the wrist. And then we're going to have intrinsic muscles that are going to do the exact same thing on the other side. Now, it's a whole lot of movement that's going on there. I'm not expecting guys to memorize all the different muscles that are causing the different parts of the hand to move, but it is obviously a very interesting thing to try to specialize in because there is a whole lot going on. Now, I obviously kind of burned through that because didn't really see any questions or otherwise, so I just kind of went for it. So we're going to go ahead and try to have a little bit of fun, emphasis on the word try. Okay. Give me one moment. So, yep, there's the basic breakdown again of going through the wonders of the bench press, of kind of what we're looking for, of what we're getting in different of the phases. Remember, I am not going to allow you guys to use that as your exercise because here is that breakdown. But now you guys are going to get a chance to work on that in small groups, and then I'll give you guys feedback. Each person's going to pick their own exercise, but you guys can pick very similar exercises, meaning someone can do a lat pull down, someone can do a pull up, and someone can do a lat pull down machine or something along those lines. So you've got a lot of similarities. Really shouldn't be too difficult, but it's at least going to get you thinking about what muscles are working when. Does that sound good to you guys? Or you not like that idea? Should I just keep lecturing? Okay, thank you. All right. So let's go ahead. I'm going to get you guys into rooms with, once again, about 3 or so people, work together. Once we come back, it's 10, 11 right now. I plan on bringing you guys back at like 10, 26 or so, and then we'll go ahead and see where everybody's at. And like I said, we'll let people know what was right, what was wrong, and have a more discussion about how these muscles work. So get after it, guys. See you guys back then. And go to Blackboard, download that basic sheet, and then try to fill it out there because that'd be the easiest thing to paste in there because I can tell you flat out if it's right or it's wrong. So keep after it, guys. Help if I open the rooms. I realized I didn't record any of that little interlude. So yes, making sure we're breaking down each of those phases. Some things, the preparation is just getting the bar set to where you need to go ahead and lift it and the type of positioning you're going to have to do. So hence using your lats when you're pulling the bar out initially for the bench press is not something you're going to really be doing that much for the rest of the time, and how all of those things are going to contribute to the positions and movement that you're trying to accomplish. So trying to break that down in each of the phases. There might not be all 4. Sometimes there might be more like 3. And yes, in those groups, picking a more similar exercise is going to make it easier to carry over from one person to the next. So it's 10:32. You guys want 5 or 10 more minutes before we meet back and start going through and looking how people's assignments are going? You guys want 5 or 10 minutes? Okay, then let's do that. Okay, so it's 10:32. I'll plan on seeing you guys back at about 10:42. So go and hop back in those groups when you guys are ready. Make sure we're breaking down each of those phases and doing our best to really thinking about how we're going through each of those portions. Rock and roll. Okay. So, we got a couple people that are putting something there. Underhand pull up. Okay. Now just make sure when we're talking about getting our way up there, that makes perfect sense. So the wind up, which, yeah, we're skipping. You're force producing. looks good. Remember, we're going to definitely be using the biceps, brachii, brachioradialis, and the brachialis, along with the long head of the triceps is going to be important as part of that glenohumeral function. But the wrist probably shouldn't switch at all. So you're definitely sitting pretty close to where you should be. Lexi, I don't know what exercise you're doing, so I don't know how I can help here. I don't know. So, Zach, same thing. Okay, for the push-up. Good. Now remember, you're also going to be looking at scapular protraction. So we've got serratus anterior function and pec minor. That's also going to be functioning in there to help move you in those positions. Yeah. And remember, it's going to be a little bit of extension, but it's also going to be horizontal adduction on that push-up. So make sure you're accounting for that as well. And obviously the triceps are important in there. Wrists, not so much. Okay, Marlana. Yes, you're also going to see, remember the infraspinatus and the teres major being important there, and make sure we're still going through each of those phases. Zach, yeah, that's definitely not too bad. The prep looks relatively correct. Keep in mind, when you're just reaching up for the bar, you're not really using your lats or your posterior delt. So make sure we're not just throwing everything on there. It's not switch one of your muscles. It's add that, because we're putting in everything that's being used. We're not trying to just put, it's not like you're limited only using 2 muscles. Your body's going to use every darn muscle it can. Like at some point, because you're going to have the total body muscles. If you guys want to see something that's wild and you're using dang near everything, we're going, maybe that'll be a fun thing that we'll break down once we get through all of the exercises. We'll do a total body example with the barbell snatch, where you're literally using nearly every single muscle in the human body at some point in that movement. Okay. All right, but guys, you're not too far off base, and once again, we ran really far over. Sorry about that. But keep working hard. Now you guys got at least a good kind of like, marching orders of this is what we're working on. Oh, okay, and now Dakota, yours is the force producing, and which movement is that? For the lat pull down, okay. Lat dorsi, retraction, yes. From the rhomboids, you're also gonna have downward rotation. So that's gonna be the lower muscles of the, lower muscles of the trap. Rhomboids probably aren't gonna be contributing too much. Definitely using the hand flexors. Also, obviously, gonna be using the biceps. We should also see long head of the triceps. We should see teres major. We should see pec major. Anouk, what is your movement? Yeah, okay, yeah, that's not bad. Now when we say trap, guys, remember we've got the upper trap fibers, the mid trap fibers, and the lower trap fibers. Technically, you can actually divide the trap into 4 different segments of where different parts of it are firing. So we got to make sure that we are saying which part of the trap. Same thing with the delt, because we've got the anterior, the medial, and the posterior. And so you're probably going to see more of the posterior. No, guys, seriously, we've ran way over. You guys take off when you need to take off. You guys take care of yourselves. But you guys are definitely on the right. You're on the right track. Just keep thinking through the muscles, keep thinking through the actions. And guys, the nice thing about this class is you can go do the movements. You can go try the exercises, feel where you feel it in your body, and then figure out what the name of that muscle is. If you want to know what muscles you use for push-ups, this is not a recommendation. It's how you get rhabdo, but go do 200 push-ups today. Tomorrow, your body will tell you what muscles you used on those push-ups. You will have no way around that. So that's the nice thing about this is you can experiment on yourself. So good work today, guys. I will see you guys on Thursday. We will probably just keep doing some more reviewing just because we're really well ahead of the course. Because the next thing that we have for you guys is the exam, and I don't think you guys want to take exam 2 this quickly. I think you guys want to take your time. So we'll try to do some more rotational physics and just come with questions, and we'll kind of keep going from there. Sorry, ran way over. Get out of here. Go have a nice life. I will see you guys on Thursday. Bye-bye.